You've probably noticed that some people seem to bounce back from stress in days, while others carry it for weeks. Or that certain people can eat anything and feel fine, while you're bloated after the same meal. Maybe you've watched someone recover from illness quickly while you're still dragging 2 weeks later. You might have chalked it up to genetics, metabolism, willpower, or just luck. But there's something else going on. Something determined before you were born, written into the surface of every red blood cell in your body. Your blood type isn't just a label for transfusions. It's a biological signature that changes how your immune system recognizes threats, how your blood flows through your vessels, how your gut bacteria colonize and communicate, and even how your body processes and holds on to stress. And most doctors will never bring it up during a routine visit. Not because it doesn't matter, but because it doesn't fit neatly into the way modern medicine is practiced. Medicine treats conditions, blood type describes tendencies, and our healthcare system isn't built to discuss things that shift probabilities without providing clear diagnoses. But that doesn't mean those tendencies aren't shaping your health every single day. Here's what's actually happening inside your body, beneath the surface of every symptom you've ever dismissed as random. Your blood type is defined by tiny molecular structures called antigens that sit on the surface of your red blood cells. If you've ever heard the terms type A, type B, type OAB, or type O, those letters refer to which antigens you carry. These antigens are like identification badges. They tell your immune system what belongs in your body and what doesn't. When something foreign enters a virus, a bacteria, a toxin, your immune system checks it against those badges. If it doesn't match, your body launches a response. But here's the part most people don't realize. These antigens don't just identify threats. They actively shape how your immune system behaves on a fundamental level. They influence how quickly your body reacts, how intensely it responds, and how long that response lingers after the threat is gone. If you have type A blood, your immune system is primed to react quickly and aggressively to anything that looks foreign. That sounds like a good thing. And in some ways it is. Your body is vigilant. It catches problems early. But that vigilance comes with a cost. Your immune system doesn't just respond, it over-responds. And when your immune system overreacts repeatedly, it starts producing chronic low-grade inflammation. That inflammation doesn't announce itself with obvious symptoms. It hums quietly in the background, contributing to joint stiffness, brain fog, fatigue, digestive issues, and long-term cardiovascular strain. If you have type O blood, your immune system takes a more measured approach. It waits a bit longer before launching a full inflammatory response. That makes you less prone to inflammatory diseases and autoimmune flare-ups. But it also means your body can be slower to fight off certain infections. Your immune system doesn't panic, but sometimes that calm costs you. You might find yourself getting sick more often or taking longer to recover when you do. Type B and AB blood fall somewhere in between, with their own distinct immune profiles. The point isn't that one blood type is better or worse. The point is that your blood type sets the baseline tone for how your immune system interprets the world around you. And that tone echoes through every system in your body, year after year, without you ever knowing it's there. One of the most well-documented effects of blood type has to do with your blood itself. Not what it carries, but how it behaves. Specifically, how thick it is, how easily it flows, and how quickly it clots when something goes wrong. People with type O blood tend to have thinner blood. Their levels of clotting factors proteins that help blood stick together and seal wounds are naturally lower. That means their blood flows more freely through their vessels. It's less likely to form dangerous clots that could block arteries and cause strokes or heart attacks. But there's a trade-off. When type O individuals are injured, their blood doesn't clot as quickly. They're at higher risk for bleeding complications during surgery or trauma. Their blood moves efficiently, but it's harder to stop when it needs to. People with type A, B, or AB blood have higher levels of a protein called von Willebrand factor. This protein makes blood stickier and more prone to clotting. In everyday life, that's not a problem. In fact, it's helpful when you get a cut or scrape. But over decades, that slightly thicker blood increases the risk of clots forming where they shouldn't. Small clots in the brain, blockages in the coronary arteries, circulation issues in the legs, not dramatically, not inevitably, but consistently enough that the pattern shows up in large population studies, again and again. Doctors treat the clot when it happens. They prescribe blood thinners, perform procedures, and manage the crisis. But they rarely talk about the baseline condition that made the clot slightly more likely in the first place. Because blood type isn't something you can change. It's not a risk factor you can modify with medication or lifestyle. So it stays in the background, quietly influencing outcomes without ever being named in the conversation. There's another layer that most people never connect to blood type, and it has to do with stress. Not just the feeling of being stressed, but what happens inside your body when stress hits. When you experience stress, whether it's a work deadline, a relationship conflict, or just traffic on your commute, your body releases a cascade of hormones. Cortisol and adrenaline flood your system. These hormones are designed to prepare you for immediate action. They increase your heart rate, sharpen your focus, and mobilize energy reserves. But they also activate inflammatory pathways in your immune system. Your body interprets stress as a potential threat, and inflammation is part of the defense response. Here's where blood type enters the picture. Because blood type antigens interact directly with immune receptors, they influence how long those inflammatory signals stay active after the stressful event is over. People with certain blood types, particularly type A, tend to hold on to stress responses longer. Their cortisol levels stay elevated for hours, sometimes days. Their inflammatory markers remain high. Their body doesn't return to baseline as quickly. This isn't about being emotionally weak or sensitive. It's not about mindset or resilience. It's about the mechanics of how your immune system and stress hormones communicate at the cellular level. And over time, that difference compounds. It's why some people seem to burn out faster under the same workload. Why do some develop stress-related illnesses like hypertension or digestive disorders earlier in life? Why do some people feel like they're always one step behind in their recovery, no matter how much they rest? Your body isn't failing you. It's responding exactly the way your blood type has programmed it to respond. And understanding that can change how you think about your own stress patterns. Now let's go even deeper into a place most people don't associate with blood type at all. Your gut, your microbiome, the trillions of bacteria living in your intestines, plays a massive role in your overall health. It affects digestion, immunity, mood, energy levels, even brain function. Most people think their microbiome is shaped entirely by diet, antibiotics, and environment. And those things do matter, but there's another factor quietly shaping which bacteria thrive in your gut: your blood type. The same antigens that sit on your red blood cells also appear in the mucus lining of your digestive tract. These antigens create a specific chemical environment, a terrain, and certain bacteria are better adapted to certain terrains. If you have type A blood, You're more likely to host bacteria that favor plant-based nutrients and produce different metabolic byproducts. If you have type O blood, your gut tends to support bacteria that thrive on a different nutrient profile altogether. This affects how efficiently you digest food, how much energy you extract from what you eat, and how much low-grade inflammation your gut produces as a result of digestion. It's why some people feel energized after certain meals while others feel sluggish. Why some people can eat dairy or grains without issue, while others experience bloating, fatigue, or brain fog. Their gut bacteria are responding to a blueprint that was set by their blood type long before they ever took their first bite of food. And this isn't about finding some perfect blood type diet. It's about understanding that your body has invisible preferences. Your gut has a default setting. And when you eat in ways that clash with that setting, your body has to work harder to process what you've given it. That extra work shows up as symptoms you might not even connect to food afternoon crashes, mood swings, skin issues, joint pain. There's one more pattern worth mentioning, and it's the one that gets the least attention in everyday conversations but keeps appearing in research: longevity. Studies conducted across different populations and countries have quietly shown that people with certain blood types tend to live longer on average. Not by decades, not in every individual case, but the pattern is consistent enough that researchers keep circling back to it, trying to understand why. The leading theory is that certain blood types correlate with slower accumulation of chronic disease markers over a lifetime. Some blood types show lower rates of cardiovascular disease, slower progression of age-related inflammation, and better maintenance of metabolic function into older age. Others show earlier signs of cellular wear and tear. The differences are subtle when measured year by year, but over the course of 70 or 80 years, those small differences become visible in the data. Again, this isn't about destiny. A person with type O blood doesn't automatically get an extra decade of life. A person with type A blood isn't doomed to die young, but blood type does seem to influence the rate at which certain systems in the body begin to break down. And that rate, accumulated over decades, affects lifespan in ways that are only now beginning to be understood. So why don't doctors talk about this? Why doesn't your physician sit you down and explain how your blood type is influencing your health risks, your stress response, your digestion, your longevity? It's not a conspiracy. It's not ignorance or negligence. It's that modern medicine is built around treating conditions, not tendencies. A doctor can prescribe medication for high blood pressure. They can order tests for diabetes. They can diagnose and treat infections, injuries, diseases. But they can't prescribe anything for being type A. They can't write a prescription that changes your blood type or neutralizes its effects. Blood type is what researchers call a non-modifiable risk factor. It's part of your biology that you were born with and will carry for your entire life. And our healthcare system doesn't have a clear framework for discussing things that shift probabilities without guaranteeing outcomes. Doctors are trained to intervene. Blood type doesn't offer a clear point of intervention. So the conversation happens in research papers and academic conferences, but rarely in exam rooms. But that doesn't mean it's not important. It just means the knowledge exists in a different space, one that most people never encounter unless they go looking for it. Here's the truth, and it's important to get this right. Your blood type doesn't decide your fate. It's not a life sentence. It's not a prediction carved in stone, but it does set the baseline conditions your body operates under. It determines how your immune system interprets threats, how your blood flows through your vessels, how your gut bacteria colonize and communicate, how your body handles and releases stress. It's like the operating system running in the background of a computer, most of the time invisible, but always influencing how well the system performs under pressure. And here's what matters most. Lifestyle can amplify or suppress these tendencies. You can't change your blood type, but you can absolutely change the environment it operates in. You can reduce chronic inflammation through diet, sleep, and stress management. You can support your gut microbiome with fiber and fermented foods. You can manage stress in ways that help your body reset instead of staying locked in fight or flight mode. You can stay active in ways that improve circulation and reduce clotting risk. Understanding your blood type isn't about fatalism or resignation. It's about understanding your body's default settings so you can work with them, not against them. It's about recognizing that the patterns you've noticed your whole life, the way you respond to food, to stress, to illness, to recovery aren't random. They're not weaknesses. They're the result of a specific biological reality that's been operating beneath your awareness since the day you were born. Your body has been sending you signals your whole life. Patterns in how you feel after certain meals, how long it takes you to recover from stress, how quickly you bounce back from illness or injury. Maybe now some of those patterns make a little more sense. Maybe now you understand why your body behaves the way it does, not because something's wrong with you, but because something specific is true about you. And maybe that's worth paying attention to.